Yeah, so how I kind of became interested or led into pharmacy, it's kind of a circuitous path. I started out, did an undergrad degree in biochemistry, so that really sparked my interest in that. Luckily, my uncle, who was a professor at Washington State University College of Pharmacy, had encouraged me to take the PCAT during my biochem training. So I had a PCAT score that I could kind of come back to when I was reevaluating things. And luckily, he had introduced me to some of the more novel pathways that a pharmacist can do. So we all kind of think of the pharmacist behind the counter in the white coat, dispensing pills and some great knowledge as well. But I also kind of got to see some of the other side of that. As I was kind of applying for school, I did work as a pharmacy technician. So I got to see kind of behind the curtain and how efficient of an operation that is and how important that work is. And also I got to see how little I knew as a brand new pharmacy technician thinking about applying to pharmacy school. So why I chose emergency medicine from a pharmacist standpoint. I really enjoy the pace of it, and sometimes there's a lull, sometimes it's very high energy, high paced. We really have to know a little about a lot. The pharmacists have a ton of knowledge, and there is absolutely a place for it in the emergency department, and I'm very happy to provide that and distill that in ways that are practical and very helpful for our patients. So emergency medicine is often described as the most interesting 15 minutes of every other specialty out there. So I really enjoy that aspect of it. And it's very much a team sport, which I participated in for most of my life. And I really enjoy that aspect. So working closely with the nurses and physicians, and we really come together to find the best outcome for our patient in that moment. And that is very rewarding. So the role of pharmacists in emergency medicine has absolutely been expanding, and it's recognized by different accrediting bodies. So the American College of Emergency Physicians just put out a statement recognizing the value of pharmacists in emergency departments. And that is a continually growing field. I think I did a 2-year residency with the second year in emergency medicine, so I have an absolute love for it and dove head first. At that time, there were approximately 8 or 9 programs across the country, so not very many. Now, fast forward to today, there's over 40, and of note, the University of Utah will be starting a program as well coming July 2019. So we will also be kind of adding to this growing body of potential pharmacy practice sites. I'm lucky to work in a pharmacy position where I don't have to wonder if I make an impact every day. I often say I enjoy my job is 95% awesome, and then there is kind of a 5% where you do have some really, tragic, sad, tough cases, and I think part of connecting with those patients and their family in those tough moments is definitely not a fun part of the job by any stretch, but something we all do and we can understand and would want in similar situations. Yeah, my advice to students who are considering health sciences or pharmacy, for pharmacy, I would always say, talk to a lot of patients, a lot of doctors, a lot of nurses, as many as you can, and really get that experience. You're going to spend a lot of time in a room full of pharmacists, and so you want to make sure you can still maintain that kind of practical knowledge, because not everyone is going to be excited about cytochrome P450 interactions or renal dose adjustments of antibiotics. So you want to make sure you can provide that important knowledge you have, but in a way that people will understand and be able to apply appropriately.